This is Anfisa from Retina Coach, and today I will talk about basic principles of fragmatome use. Fragmatome is basically a phacomulsification handpiece without a sleeve. It should be remembered that as well as phacotip, fragmatome uses ultrasound to emulsify and aspirate lens pieces. Fragmatome cannot cut vitreous strands like vitrector does. That's why, before using a fragmatome, proper core vitrectomy should be done to prevent vitreoretinal tractions and retinal tears. Most of fragmatomes are 19-20 gauge. Smaller gauge fragmatomes are still not commercially available. An important point is that aspiration rate of 20 gauge fragmatome is much more higher than the infusion rate of 23, 25 or more gauge. That's why before starting suction, need to elevate infusion pressure in the eye more than 30 mm of mercury to maintain an eye pressure. Other thing that can help to prevent an eye collapse is to use a fragmatome ultrasound only when the tip is occluded with the lens particles. Remember that fragmatome is quite an aggressive instrument. That's why small pieces of nucleus or cortex should try to be removed by using a vitrector. And in the end of the case, vitreous base should be evaluated well with indentation for retained lens particles and retinal tears and holes. Like in a phaco, when the fragmatome tip is occluded, a negative pressure builds in the system, and when the occlusion clears, aspiration rate increases suddenly, leading to pressure fluctuations. Surge effect can cause the retina damage by the fragmatome tip. To prevent this, engage the lens fragment and move with the fragmatome away from the retina to the center of the vitreous cavity, and also use a micropulses. There are a few options to set a foot pedal for fragmatome. The first option is that vacuum increases continuously while depressing the foot pedal towards the floor, and emulsification of the lens fragment happens when the pedal is completely pressed to the floor. In this case, emulsification combined with a very high vacuum, which can lead to a surge effect when the occlusion of the fragmatome tip disappears. The second option is that vacuum increases continuously while depressing the foot pedal towards the floor, but emulsification activated by side click of the pedal. It means that at any level of the vacuum, emulsification can be done. This option allows to perform phacofragmentation more controllable and to decrease the surge. You're invited to visit the Retina Coach website to join our team and to share your own videos and surgical techniques so we can all benefit from your experience and knowledge. Thank you for your attention.